Once again, I want to welcome you. Tonight's lecture is Stress Hormones and Your Health. And it's my pleasure to introduce Dr. Scott Saunders. He's the medical director of the Integrated Medicine Center of Santa Barbara. We are over on Mitchell-Terrain Street here in Santa Barbara. He used to be in Lompoc. Some of you may have known him from that area. He's also the medical director of the Central Coast Nursing. And he's also medical advisor for Barton Publishing. He has published quite a lot of articles, and he co-published many books for Barton as well. I find him to be an excellent speaker. You're going to get lots of information tonight. It's going to be very informative, and I'm sure you're going to have a good time. As I said to you earlier, I will be serving dinner after the lecture. So if you please join me in a welcoming Dr. Saunders.
Thank you, Suzanne. Okay, what I want to do is I want to make it fun, and I'm going to go through some very specific information, and so I'm not going to be taking questions while we're here. If you have any questions, just remember, write them down, and afterward I'll be in the other room, and you can ask questions. So while we're here, first I want to introduce myself. I am a recovering physician, is what I say. And the reason for that is because I went to medical school at UCLA and stayed around Los Angeles to do a family practice residency at Northridge Hospital. I finished family practice. I delivered over 200 babies. I did brain surgery, and I did everything in between. And so when I got out, I thought I was going to heal people, you know, make people better. And what ended up happening was something very different. What I wanted to do, what we now do at the Integrated Medicine Center, is we get to the roots of disease. What's his name? Henry Walden, I was thinking of. Thoreau, in the book Walden, said, there are 1,000 hacking at the branches of evil to one striking at the root. And so what I was taught as a physician in medical school was to hack at the leaves of evil, or disease. What is that? Well, if you're hacking at the branches, you're just doing the symptoms. So you're treating symptoms, this symptom, that symptom. So people, what do? They go to their doctor and they go, well, I'm getting migraine headaches, and I'm gaining weight, and I got this arthritis in my knee, and so you go home with one pill for that. Oh, your blood pressure's high too, so you need a couple pills for that, a couple pills for that. You go home with an armful of medications and you're popping pills all day. Why? To decrease symptoms, to just look at symptoms, and instead of going at the roots. So what the Institute of Medicine has said, and this was published in the British Medical Journal, 85% of all procedures are scientifically unproven. We're not sure if they actually work or not. And 90% of all diseases prevalent today are not treatable with the methods of drugs and surgery that we commonly use. What do we do? Well, so you are all the doctors now. I'm the patient, okay? Okay, doctor, gosh, I have not been feeling good, and these are my problems. Okay, what do I have? Right. Come on. Come on, doctor, I'm getting there. I need help. Okay. What this is the side effects of a common medication, one of the most commonly prescribed medications in the world. Okay, and this is how I first got started into this functional medicine program. And this was during residency. I had a man come in, and he was on this medication, and he was getting muscle pains. He was getting, oh, we missed it, rhabdomyolysis is what it's called. Dark urine, and he was had pain all over, and I didn't know what his problem was. So I started reading. I looked at the side effects of the medication. I go, oh, this is probably it. So I went to my attending physician and I said, this is what I think is going on. He goes, oh, just switch into a different one. And I'm like, wait, switch into a different one. it wasn't even lowering his cholesterol at that point, so how is that going to be? I couldn't see how that would be any better. So what I did instead is I gave him red rice yeast extract and told him to take coenzyme Q10, because that's what I read when you have that. The reason you get that is because it blocks the production of coenzyme Q10, so you can't make energy, so the muscles start dying. So I had him take the extra of that. He came back in a month, his cholesterol was normal, and he didn't have any more of the muscle aches, and he had more energy, he was feeling a lot better. And I'm like, wow, this stuff really works. So I got out of that, and I went to, I finished my residency, got board certified, and started working at the Lompoc Community Health Clinic for the county of Santa Barbara. And I worked there for 6 years, but while I was doing that, I was studying functional medicine. And in spite of that drug being the most commonly prescribed drug for cholesterol, there's no evidence linking high cholesterol, and there never was. There's a movie out now called The Greasing of America, and that's what it's talking about. What is the real evidence that you have? So why does that happen? We have a health crisis in America, and the health crisis is that we're not being told the truth, that there is an advertising gimmick, and if you have a $1 billion a year advertising budget, guess what happens? You have enough money to sell just about anything, because you can convince people of anything. So everybody in this room has been told cholesterol causes heart disease, right? Guess what? It's not true. And you've been told that high blood pressure causes strokes and heart attacks, right? It's not true. The blood pressure is actually a symptom of a process that's going on, including hardening of the arteries. So yes, people who have high blood pressure also are more likely to get strokes and heart attacks, but it's not because of the blood pressure. And that's why lowering the blood pressure doesn't do anything. But if you have enough money to put that into the system, then you can convince people of anything. So what is America's healthcare crisis? It's wrong or lacking information, basically. Do we know what's going on? So one of the things we're going to talk about tonight is what do I do then? I'm told this and this, and I'm told in order to prevent Alzheimer's disease, I have to, what do you have to do for Alzheimer's disease? Exercise, prevent inflammation. So block inflammation, that would be the way to do it. If you look at health on a scale, and you look at increasing health, and so if you have 0 health, you're dead, right? No health. A little bit more and you're incapacitated, a little bit more and you're sick, and then you get to a point where you're still sick but you don't have any symptoms. A lot of people come to me with that. And that's why we do physical exams. You do your annual exam. What are they looking for? Well, they're looking for the illness that you don't know you have yet, because you don't have any symptoms. But if you can get out of that, you can actually be healthy and not have any symptoms because you're healthy. But when we learn in medical school, the optimal place to be for all the doctors is there, no symptoms, right? So you go and you have migraine headaches, right? What does a doctor give you? A pill. A pill. And what does it do? It relieves that headache. And you know what? They work. My sister-in-law has been taking, she told me yesterday, she was taking Imitrex every single day because it allows her to function, because she gets migraine headaches every day. It allows her to function. But guess what? She's still sick. She's not better. She didn't get all better. And that's with anything. Blood pressure, cholesterol, heart disease, even cataracts. You know what we were told in medical school? If you have a small problem, just wait until it becomes a big problem, then we'll do something about it. Have you ever heard of that? Yeah. Oh, your cataract's only 20%. Let's wait till it's 80%, then we'll do surgery on it. Yeah. Oh, your heart blockage, it's only a 50% heart blockage. We would usually wait till they're about 70%, and then we'll do something about it. Does that make sense? I mean, you're all laughing. Is that funny? It kind of is, especially in 21st century medicine. We know how to reverse that process. We can reverse diabetes. we can reverse Alzheimer's disease. And I'm going to tell you about a few cases of that today. So what we're told is to keep people in that box. If you keep them in the box all the time, guess what? You have a great business model, because people will keep coming back every month for their refills of their medications. And you won't need to have to advertise and help people to get better. Okay. So our crisis really comes from our habits. The health habits, not being proactive. Proactive means I'm going to get out and do something about it. I'm not just going to sit around and do nothing. So have you ever seen anything like this? This is funny to you guys, but actually the reason I got this picture is I had somebody, I asked people, how much exercise do you get? And this one woman said, well, I walk the dog every day. That's what she does. She's not getting very much exercise. But this is the kind of thing that really leads to the problems that we're facing. The other part is food. And we have a definition from the Macmillan Dictionary. Food is that which is eaten to sustain life, provide energy, promote growth, and repair of tissues. Okay, think about that definition for a minute. Growth, repair of tissues, and then ask yourself, is this going to do all of that? No. So if you look at the definition of food, by definition, this is not food, right? Does that make sense? And that's where our health habits are. So when we make a change, we always have to have a why. Why do we change? You know, what are we going to do differently? And then why? So for me, that's my family. This is my wife, and those are our 13 children. And I had those are yeah, that's my wife and our children. So I had my sister-in-law, the same one taking all the Imitrex for her migraine headaches, came to me, and she has a 6-year-old, and she said there was a big wake-up call last week. She started getting palpitations of her heart. She had an arrhythmia of her heart, and she felt like, she says, I can't breathe. I think I'm going to die. She was, at the moment she said, I think I'm going to die, she thought that in her head. She looked over at her 6-year-old son, and she goes, oh my gosh, I'm going to miss everything. And she called me that night, and she said, I need to talk to you. So she came over, and we talked. And we went through all of the issues that she's been dealing with, and we're going to do some tests, and we're going to do a program, a functional program to get her heart working well, to get her out of migraine headaches, to normalize her hormones, because the hormones are essential in that. You want to be able to be active. You want to be there with them, to be able to do things. Because your other option is not that good. As Suzanne told you, I'm the medical director of a nursing home. This particular nursing home, I took that picture. Those are my patients. And people end up there because of the way, primarily the way they take care of themselves. I have a 26-year-old woman in there, and the first day I went to her, I went through her whole chart, went through all her medical records, why she was there, and all her labs and everything. And so I sat down with her and I said, look, you have this, 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 this. We can reverse this process, and you can be out of here in less than 6 months. And she said, let me think about it. She's still thinking about it. It's been 2 years. So, well, it's hard. Sometimes it's hard to do things. So you have to have a why. You have to be able to say, because I love somebody that I want to be with, or because I want to avoid the pain, the misery or whatever of being in a nursing home. And we've seen that before. So I want to tell you about Holly B. So talking about what in the nursing home, she was going to a local clinic, and she said she would drive in the parking lot, and she would see the older people going in with their walkers, and people going in and out, and people that are sick and needing a lot of help. And she just assumed that that's what everybody does. And that's the way everybody lives, that eventually she would be there in that position. And because she was pretty sick and needed a lot of help. Well, she came in to see me, and I explained to her that there are no diseases of aging. That aging is a process of change, but there's no disease of aging. You don't have to lose your memory. You don't have to get Alzheimer's or Parkinson's. You don't have to get arthritis. Those are things when you let a process go for a long period of time, they happen, yes. Okay, if I had a brand new car, and I drive it off the lot, and I'm driving and driving and filling up with gas and driving, and it starts breaking down, and I take it in, and I go, I got a 5-year warranty on this. I've only put 50,000 miles on it. And so the mechanic checks it out and says, when's the last time you changed the oil? I'm like, oil? What oil? And he goes, no wonder it's breaking down. Well, the body's like that. If you don't change the oil, if you don't take care of things the way they're, if you don't get enough nutrients, if you're filled with toxins, then things break down. And we call that aging. It's not aging. It's just breaking down because of lack of care. So she came into my office, and that's what she told me. She said, thank you for giving me a new vision, because when we do programs, and halfway through her program she started feeling better, and she said, oh, I can actually do this, and I'm going to have a functional normal life until whatever the end is. Like that guy, the 111-year-old guy in, where was it? Out San Bernardino. I don't know. He's 111 years old, and he died in his garden. He was gardening. It was only a couple of years ago. I'm sure you guys heard of that. That's the way it should be. Okay, so talking about stress, there's positive stress and there's negative stress. And positive stress builds. We need stress. We need it. You know what happens to astronauts up in the space station?
Their bodies start to atrophy because they don't have gravity.
They wither away. And it happens fast. Do you realize that they lose 4% of their muscle mass every week they're in that place?
Calcium in their bones.
Calcium in their bones. So, and they can give them all the vitamin D and all the calcium, pop the calcium pills they want, and they will not build any stronger bones because there's no stress on them. You have to have stress. So, you know, the lifting weights or doing exercises, or other kinds of stress, having a family. How many know family is stressful? Hey, I got a lot of children, and you know what? Having a family is stressful. But what happens with that stress is building. You're growing children up to become adults. And in the process, we grow too. We learn and grow in the process. That's the positive stress. Or going to college. You have all this stress. I got to read all these books before next Tuesday, and all that going on. You're learning, you're growing. And that's what positive stress is. And then negative stress. Now, the definition of negative stress is whatever tears down or breaks down. So, negative stress comes in many different forms. But I want to tell you first a story about Jack. Jack and Joan live in Lompoc. And his wife brought him in like he was shuffling in, you know, she kind of dragged him in. And he'd been diagnosed with Alzheimer's disease. And he couldn't think clearly, he couldn't calculate in his head, he had pain all over, and it just wasn't a typical case of Alzheimer's. And he did have a memory deficit though, he didn't remember things well. But he'd been given the medication for Alzheimer's, and she said, this isn't even working, do you have anything better? And so I said, well, let's start from the beginning. So we went back through a functional medicine paradigm, and that is, remember the root cause? Look for the root cause. So we started looking, and we found that he was a welder. And that for the last 5 years since his retirement at 65, he's now 70, he had been cutting with an argon beam torch. And what that does is vaporizes metal. And all he has is this mask on. He doesn't have the full respirator, thank you. And so we go, huh, guess what he has? Heavy metal. So we actually checked his lead levels off the chart, 50 times the upper limit of normal. It's a wonder he was walking around at all. He didn't have anemia, by the way, and Medicare would not cover anything. They said he doesn't have anemia, therefore he can't be lead toxic. Because we did the urine test, and the blood test didn't show it. So we had, anyway, so we did a series of chelation treatments that weren't covered by Medicare, and he got better. So within 1 year, he was back to normal. And his wife came in, and she was crying. And she said, she brought him in for another reason, and she said, you know, I can't imagine what it would have been like to live with him, you know, the rest of his life, having to take care of him like that. And now he's welding, actually. He comes in for periodic chelation treatments, but he is welding still. So if you look for the cause, if you look for the root cause of where the stress is coming from, you can find out where it is. So there's 3 basic types of negative stress. Physical stress. This is trauma. This is where you fall out of a building or you have a car accident. That's the damage that's done. It's physical damage. That's stress. And then there's the chemical stress. That's heavy metal poisoning, organophosphates, people spraying. Do you know that glyphosate, what is that, Roundup, is the inert ingredients are more toxic than the actual insecticide, I mean the herbicide. That it's pretty toxic. In France, they banned it because of that. Chemicals come from all kinds of sources all around us, and you may not know it, but somebody next door is using it, and it's coming over, and you're breathing it in, or whatever, or it's in food that you don't realize, you don't see it. And then there's, of course, emotional stress, and that's where we got the family part, right? Wherever your heart is, that's where you get emotional stress. So you don't get stressed over someone you don't care about. If one of you said, I don't like you, I'd go, okay, fine. I don't care if you don't like me. But if my wife said, I don't like you, I'd go, oh, that hurts. Right? So it's different when your heart's in it. So with that stress, we have hormones. And hormones are so important. Hormones affect every single cell in your body and everything that happens. And every cell from the top of your head to your toenails has receptors for these hormones. And so there's something we call anabolic hormones, and these are the ones that burn fat, and they're the ones that build up the body. So testosterone is a bodybuilder, thyroid uses the energy, the fat energy, human growth hormone, and glucagon, adrenaline. These are the ones that are they tend to be more building or fat burning. And then there's the ones that are storing, and these are catabolic hormones. So, you know, the cortisol on there, you get a shot of cortisone. Anyone had a cortisone shot in a joint or anything? And they said, well, we'll do one, but you can't get more than one. Or we won't do it more than once a year, right? Is that what they tell you? You know why? Because it's a breaking down hormone. It actually breaks down your body, the connective tissue, so your tendons and ligaments will break down. And they used to just give shot every time you come in. Okay, you know, every couple of weeks or months, somebody comes, I need another shot, doc. It's killing my shoulders, killing me. Another shot, another shot. Pretty soon, it was the shoulders the tendons would get so soft they would just break, and then the surgeon would go in to fix them. You know, a rotator cuff tear or something. There's nothing to put the needle into because this tissue is too soft. Why, that happened to you?
Oh, yes.
Yeah. It's crazy, huh? So, these are the catabolic hormones, insulin. Now, I want to talk about insulin a lot because this is a really, really important hormone, and everybody only knows it as diabetes, right? If you have type 1 diabetes, you have to inject insulin. That's all we think about insulin, right? Because before insulin was available for injection, people with diabetes would waste away and die. They would just, their fat would disappear, they would shrink down, their fat would disappear, and then the body would start using their protein for energy, and then they couldn't use any more and they would die. It's pretty sad. so getting insulin as an injection was a miracle. It was quite miraculous, because these people that had no insulin from their pancreas could now survive. Not only survive, but live well. They could live normal lives. And so, so that's the way we think of insulin. But insulin is a hormone. It has effects on every single cell in the body. And what it does is it's the primary, the main, and as far as even these are concerned, the only real fat-storing hormone you have. So if you have, if you're overweight, if you stored too much fat, it's always because of insulin. If you didn't have insulin, you couldn't. I actually had a patient that had this. She had diabetes since she was 3 years old. She was in high school, and somebody told her, if you don't inject insulin, you can't gain weight, no matter what you eat. And she's like, really? Cool. So she'd go to a party, she'd eat everything she wanted, and she'd say, I'll just not use the insulin this time. And her sugars would go up to 800, 1200. She'd end up in the hospital, almost in a coma, and of course, you know, she's there in the hospital for several days. So she's leaving the hospital, and the doctor says, now you give yourself insulin. Okay, doctor. You know, she's real cute too, cute young girl. And then she'd go back out, and she'd use her insulin, but then she'd go and eat a lot, and she'd say, well, I'm just not going to give myself insulin this time. She'd do it over and over again, end up in the hospital again, back and forth. And you know what? She never gained weight. She didn't. She could eat anything she wanted, she wouldn't gain weight. Insulin is so important. So if you look at what insulin does, it brings sugar into the cells, including fat cells, where it's made into fat. And it brings sugar into your other cells where it's made into glycogen. And then once the cell is full, fat cells never get full, by the way, never. You can keep filling up fat cells, they don't stop. But all of your muscle cells, all of your other cells in the body, they fill up and they stop. And when they stop, they block out the insulin receptors so that insulin doesn't work anymore. So people say, you have insulin resistance. What is insulin resistance? Your cells are too full of sugar. That's it. That's all insulin resistance is. And so we think of insulin as something diabetics need, and because of the way it was used with type 1 diabetics, the doctors just kind of translated that to type 2 diabetics, and it goes, oh, you need more insulin. Well, what's going to happen to somebody whose cells are full up with sugar, and you start injecting insulin to try and force more sugar in there? What's going to happen? Number one, either it doesn't work. I had this as a case one time. Or number two, the cells die. And both of those things happen. So the complications of diabetes increase with insulin use. They don't decrease. So people think that oh, I'm keeping my sugar normal. I'm injecting the insulin. I'm keeping my sugar normal. And their blood sugar is indeed staying normal. But what's happening in their liver is the liver cells are dying and they're being replaced by fat. You get something called fatty liver disease. Has anyone in here had fatty liver disease or known anybody? It's not uncommon. I've had people who don't even know they have diabetes have fatty liver disease already, because the cells are already so full they're dying and being replaced by fat. So that's why insulin is so important, and why it's a key ingredient in what we call one of the problems, the health crisis of America. So I talked about the exercise, you know, the being proactive, and then the food. So the types of food that we eat tend to be high glycemic types of food, things that are processed, that are sugary, sweet. So what causes the release of insulin? Sugar, right? And starch, and sweet. Now there's something you didn't know. Right, you guys are going to know more than all of the endocrinologists in town by the time we're done here. Okay, sweet taste. Do you know you have taste buds in your intestines? No. You ever tasted food after you've swallowed it down? No. So why are they there? They're there to tell your pancreas how much insulin to put out. So you have not just sweet taste buds, you have other taste buds too that determine how you digest and absorb and utilize your food. So after you've eaten something sweet, it goes down, it goes past the stomach, and there's taste buds there. And the taste buds say, oh, it's sweet, make more insulin. So do you ever wonder why the Pepsi study that they would never publish, the one that showed the diet Pepsi and the regular Pepsi, and they had the people drinking it, this was in the 70s, this was a long time ago. And the people in the diet Pepsi gained more weight than the people in the sugar Pepsi? And they wouldn't publish the study? It was a big controversy. I know you guys probably remember that. Because they wanted people to think that the diet Pepsi was like for diets, like you're going to lose weight on it, but you gain more weight. You know why? Because the sugar, the non-sugar, this artificial sweetener, is 300 times sweeter than sugar. So the sugar was better for you actually than the diet. Yeah. So people that they go to McDonald's and they have a hamburger, French fries, and a Diet Coke. Okay, they're actually worse off than if they'd have a regular Coke. You know. So insulin, the hormone, is so important, and that's why. So I'm going to tell you about somebody that had this issue. Her name was Maria, and she lives in Solvang. And she's only 22 years old. She's in college and she's gaining weight like crazy. And she doesn't know why. Why am I gaining weight? She was on the HCG injection diet. She was on, she did the mesotherapy, the injections into the fat. She did the laser treatments, I forget what they call that. She had been to doctors from Thousand Oaks to San Luis Obispo trying to find out what was going on. She came into me crying, tears. I'm only eating 1,000 calories a day of natural, healthy food. Everything is organic, everything is natural. I eat raw food as much as possible. Only 1,000 calories a day. How many of you have ever tried 1,000 calories a day? It's not very much food, is it? It's only a little bit of food. And she's 22 years old and she works out every day. And she's gaining weight. And I said, you're lying. There's no way. You know how I know you're lying? Because you burn more calories than that in a day. She goes, no, I swear. I swear. And so what I do, I have an automatic thing that we do on that. Have them write down everything they eat. I'll tell you why. I'll tell you why. I was at the Lompoc clinic and this woman came in and she was 400 pounds. And she was like, I don't eat nothing. My dad was almost 500 pounds, but he ate like a pig. And I swear, I don't eat nothing. It must be genetic. Must be genetic because there's no other way. I'm like, okay, write everything down for 2 weeks and come back. So she came back and her eyes were like this, but she goes, you would not believe what I eat. I'm like, okay, show me. She had this list of what she ate. Let me think. One of them was 6 o'clock, lasagna, 1 pan. I'm like, you ate the whole pan? She goes, well, I'll eat 1 piece at a time. That was 6 o'clock in the evening. She got hungry again at 9 o'clock and went out for a hamburger. And 6 hamburgers. Yeah, so she said, I guess I don't need you anymore, do I? And so I never saw her again after that, so I don't know what happened. But when you know what the problem is, it really is easy. It becomes easy. So in Maria's case, I had her write everything down. And it came back and she said she was honest. This is exactly what I ate. She had gained some weight, because usually, sometimes when people write down everything they eat, they go, well, I don't want to eat that because I'll have to write it down. And they lose weight during the 2 weeks that they're writing down. So I go, aha! So, but she gained weight, and I added up the calories, and it was about 1,000 calories a day. So we did some testing. And we don't guess, we test. So we tested and found out her insulin level was 65. Normal is 5. She had so much insulin resistance, and remember, fat cells don't stop. All of the other cells get insulin resistant, but the fat cells don't. So that really high level of insulin guess how much sugar is being pumped in, and fat and everything is being pumped into those fat cells to store. And she can't use it for energy. Because the other thing is, has anyone ever heard of hypoglycemia? Why do you get it? Because of too much insulin. Always it's too much insulin. Because normal people, normal metabolism is, you're burning sugar, you eat, you're burning sugar, and you run out of sugar, what happens? Switch, fat burning, boom, you're on. No change in energy, no change in anything. Normal people do that. They just switch to fat burning, then that's natural and automatic, and that's what always happens unless you have insulin. Insulin blocks sugar, fat from being used. You can't bring it out to use it. So that's what hypoglycemia is. So, why was she gaining weight? Because of her insulin. When you know what the problem is, it's easy. So we put her up to a 1,500 calorie a day diet. It still isn't a lot of food, but it was okay. And we changed the types of food she ate. Oh, I didn't even tell you what her organic, totally natural diet included. Watermelon, grapes, cantaloupe, sugar. So she's pumping up her insulin. Because remember, she's causing the release of insulin. Sweet taste and the sugar both cause the release of insulin. So she's pumping up her insulin, holding on to fat, and that's why. So people that tell you I can get fat on water, you know what? I didn't used to believe that, but now, as we do as I've done more research with hormones, if your hormones are out of whack, that's one of the things that can definitely affect your system, and you could gain weight on practically nothing just because of that. So when you look at somebody, you look at where they carry their weight, you can tell a lot about what their hormones are. So before I even do hormone tests, I look at, well, what body type do they have? So does anyone have a good guess as to what the far left body type is?
Hair.
What is it?
Hair.
Wait, yeah, no, but which hormone causes that type? Okay, so this type, it's not really clear because these are kind of squashed. This is the thin arms, thin legs, and thin belly, but the big hips.
Yeah.
What does that?
What hormone?
Yeah, what hormone does that?
Estrogen.
Yeah, good. You guys are good. Okay.
I didn't hear the response.
Estrogen. For some reason. Is it cold in here?
Yeah.
Yes.
Okay. It's freezing in here. Okay. Yeah, you know what? My hands are cold too now that you mention it. Okay. So this one is kind of squashed too. This one is, they tend to be large all over, large with a big belly.
Cortisol.
Cortisol, very good. That's cortisol. The difference with adrenal hormones, the cortisol causes like you get the double chin and you get big all over, but with a large belly. As opposed to the next one, which is just generally large all over. Just like top, bottom, it's all the same all over. Thyroid, very good. That's exactly right. You guys are good. And so the last one is a guy. I don't know why they have that. And he has thin arms. Well, it's not thin, but they should be thin legs and a big belly. Just a big belly, nothing else. Thin arms, thin legs, just belly sticks out. What is that? Insulin. Insulin. Why? It's not the belly, it's not the fat on the skin. The insulin causes you to put fat around your organs. So around your liver, your kidneys, your omentum gets really big. So it pushes out like a pregnant woman. My daughter was this high, 3-ish years old. And her grandpa had his shirt off, was working outside, it's kind of sweaty. And he's leaning against his truck, and she's like right up next to him, looking up, and she says, "Papa, are you going to have a baby?" And he had the classic, he liked to drink a lot of beer, and he did drink a lot of beer. So what is beer?
Sugar.
Pure carbohydrate. So it causes release of insulin. When I lived in Venezuela, by the time a man was 30-ish years old, they drink a lot of beer in Venezuela, a lot. And by the time they were 30, they couldn't button their shirts. The belly would stick out too far. So they would actually button halfway down and leave the belly sticking out. Or if they were wearing a t-shirt, the shirt would come down to here and the belly would stick out. And that's the way they were. But they had real thin arms and thin legs. But they just had a big belly. Insulin and beer or wine or whatever is a big one for that. So that's you can look at somebody's body type, and now you guys are going to go around, oh, I know you got an insulin thing. You got a carbohydrate problem there. So somebody who eats like perfect food with diet drinks, for example. I actually had a case of this, I got to tell you. A woman who was on broth, she's just having broth and a salad and a tea every day, and that's all. So she's mostly living on broth, but one salad a day. How much weight do you think she's going to lose? Well, she was expecting like 10 pounds a week or something with that little, the starvation kind of stuff. And she came in and she was really upset. She only lost 4 pounds. And I said, okay, so what is it? What do you put in the broth? And there was nothing there. Okay. What about your salad? She said, well, sometimes I cut up some chicken. Protein can cause release of insulin, by the way. Protein. Protein powders are junk food. Did you know that? You did? Protein powders cause insulin. They cause the same thing beer does. Number one, they sweeten them. Number two, protein causes the release of insulin. So you got a double problem there. So then we looked at everything. So her tea, what do you put in your tea? Oh, I put 3 drops of stevia. That's it. Stevia causes the release of insulin. So, and stevia, it's true, it's all natural, yeah, all that. It's good for you, fine. But if you want to keep your insulin levels down, stevia is not a good idea. That's all. And so in her case, we took out the stevia, and she was successful. She lost about 30 pounds in a month. That's what she wanted to do. You know what? I got to tell you why. So why is she on a starvation diet? And we do this sometimes with people because the only thing ever proven to prolong life, prevent cancer, prevent diabetes, prevent heart disease, all of that, there's only one proven method. What is it? Is it a supplement? Resveratrol? Coconut oil? Exercise? No. Fasting. Fasting. And you know what? There's no downside and there's no bottom line. There was a guy in Scotland in 1968, weighed 480 pounds. And he went to his doctor and he said, I am sick of weighing 480 pounds. I'm not going to eat until I'm 180 pounds. The doctor said, you'll die. He said, I'd rather die. The doctor said, well, at least get in the hospital. So they put him in the hospital in Scotland in 1968. And he was there for 2 weeks, and because the books, the medical textbooks said if you fast for 10 days, you'll die. It said that in the textbook. You know where that came from? A doctor just made it up when he wrote a textbook. There was never any research done on it. It just came off the top. They traced it back, and so he said, he's writing a book, and he goes, well, how long do you think people can live without food? Well, without water, maybe 3 days. Without food, maybe 10 days. Okay, 10 days. Now it's in the medical literature. Now it's truth, right? So so after 14 days, he said, I am so bored, I'm out of here. So he took off. They gave him a electrolyte pill, salt tablets to take because you lose it in your urine. So just replacing that. 0 calories, and drink water. So he celebrated his 1-year anniversary without food with a glass of water. 18 days later, he was 180 pounds. And so do you think that was healthy?
He was living off the storage.
He's living off the storage. He had stored food, right? It was all there. Everything he needed was there. The fat doesn't just store energy. It actually has some minerals, and there's the fat-soluble vitamins are in there and stuff. So he's not completely deficient in things. 5 years later, the Journal of Postgraduate Medicine went back and looked him up, to see how he was doing, he was still 180 pounds. And the reason for that is because the difference between fasting and dieting, when you fast, the stomach is empty. And the important thing about being empty is, remember those anabolic hormones, human growth hormone? People spend thousands of dollars a month. I have patients come into my office wanting prescriptions for human growth hormone that they can inject in because it's only injectable. And it's really expensive. And they inject it to keep their human growth hormone levels up. But guess what happens if you empty the stomach? You produce ghrelin, growth hormone releasing hormone, that causes you to release growth hormone. And that builds up the body. It repairs the lining of the intestines. It suppresses the adrenal hormones, the stress hormones. So when we talk about stress, fasting is wonderful. So when you shrink the stomach down and you reset the hormone system, the metabolic system, by resetting your insulin, making you sensitive to insulin again, with fasting, then you've reset your system. When you're dieting, you never reset the system because you keep eating. Isn't that interesting? So, I already told you a story about the guy that was in Scotland, right? That was good. Okay, so now we know all about hormones. Okay. Some people, they go into the doctor and they say, oh, I feel horrible. I feel like my thyroid is low. And I'm weak all the time. I'm tired. And the doctor does a test. And the test is called a TSH test, thyroid stimulating hormone. It's not a thyroid hormone. It's a pituitary hormone. That's the pituitary hormone that tells your thyroid gland what to do. So this is thought to be a good way of testing. And then the test is normal. The test is normal. So the doctor says, no, your thyroid's normal because the TSH was normal. Well, guess what? That may not be the case. You actually have the abnormally low on one side is about 0.3 in most laboratories, and the abnormally high is anything above 5.7 in most laboratories. That gives you kind of the range of where the doctor will be looking for. If you're anywhere in that range, you're normal. Look at the numbers. 0.3 to 5.7, that's more than 10 times difference. So you could have 10 times more hormone than you need of this TSH, which I'm sorry, it's kind of hard. When this is high, your thyroid is low. When this is low, your thyroid is high. Okay, because I told you it's not a thyroid hormone, it's a pituitary hormone. So when it's high, the brain is saying, make more, you don't have enough. When it's low, the brain is saying, you have too much. You know, don't make any more. So does that make sense? Okay, but you could have 10 times more than you need, and you're still in the range, so it's normal, right? Is it really normal? Not necessarily. Because what if functionally your normal is different? What if you have a functional lab range of like let's say 1.8 to 3.0, and that you need to be in that range? How would you know? Well, we have other ways of testing. We actually look at the thyroid hormone levels, and we look at the ratios between them, and we look at your functioning. So symptoms, the symptoms that you come in with are good enough to tell us, this could be a thyroid problem. So sometimes your hormones will tell you things that the laboratory will not tell you. So it's really important that you understand how to interpret the labs, because even endocrinologists, not just most doctors, even specialists, don't interpret them according to the individual. They interpret them according to the lab. The lab says this is normal, therefore that's normal. Right? I have people who are 0.05, and they're normal for them. We have to raise up their thyroid until they say, I feel normal. I can function. I'm not cold all the time. I can get out of bed in the morning. They're normal. And that's what it took to get there. So we allow a functional level. Things like testosterone. Remember, we don't guess, we test. A lot of men come in and they say, I must have low testosterone because I'm losing my muscle mass and I don't have any libido anymore. And so we test. You know what interesting thing about testosterone is a hormone? Testosterone has probably little to do with libido in men. In women it has more of an effect, but in men it has little effect. It's really weird that even men with low testosterone and low libido, you give them testosterone, only 10% say they improve. It's not huge. Some do have improvement, but it's not like, you know, oh boy, I got the testosterone. It doesn't really work that way, which is kind of funny. But testosterone is still very important to prevent aging. You need to keep your levels of testosterone up. So guess what happens if you are one of those insulin guys, the guy on there, right, the big belly, and you have all that visceral fat. Well, that visceral fat makes an enzyme that changes your testosterone into estrogen. So what happens? Whoop, like that. And it increases your risk of prostate cancer, another cancer. Estrogen is a pro-cancer kind of hormone. It also, it decreases your libido. It makes you more resistant to insulin. Remember, the estrogen was one of those. So one of the things that is important is where your hormones are in relationship to other hormones we have to test. So the lab says between 200 and 800 is normal, but the studies show that probably between 400 and 600 is optimal. So we're looking for an optimal range of hormones and not just what the lab says is normal. Because do you know where laboratory tests normal comes from? This is really funny if you think about it. You're being compared to everybody else. So they do 10,000 tests, let's say 100,000 tests or 1 million tests. They make this graph, this bell curve. You've heard of the bell curve, right? So everybody's on this graph. There's people that are way low and people that are way high, and most people are somewhere in the middle, right? That's the bell curve. So then they go, I don't know, random and arbitrary, they go 5%, you guys are too high, 5%, you guys are too low, 90%, you guys are normal. And that's where that normal comes from. It has nothing to do with function. It has nothing to do with how your body works or whether you need it or not. It's really only about a comparison to a large group of people. That's why endocrinology has to be an individual or individualized to each person, because the laboratory is not going to tell you really where you should be. So the other thing we test, cortisol. If you're testing cortisol, cortisol has a normal circadian rhythm, it's called. That's what gives you awake and asleep. So in the morning, cortisol comes up in the morning and it goes down at night. So when the cortisol is released, somewhere between 5 and 7 a.m., then you wake up and you go, boom, I'm awake. And everything starts. Remember, every cell in your body has receptors for cortisol, and so all your cells are waking up. I mean, it's really interesting. I share something with you on this. As far as the weight thing goes, they took 32 adults and gave them a 2,000 calorie meal. And it's the same, everybody got the same meal, 2,000 calorie meal. When they gave it to them at night, they, as a group, not the individuals, they measured the group gained weight. When they gave them the same meal in the morning, the group lost weight. Isn't that interesting? Because the cells are all waking up, they're using the energy, whereas at night, everything is like shutting down, store it. So it all gets stored. Pretty interesting. So your circadian rhythm has to be this circadian rhythm. So what if you release your cortisol in the morning and you wake up, but by mid-afternoon you're dead tired. But all you tested was your morning cortisol. That's all endocrinologists generally test. Oh yeah, your morning cortisol, you release enough, you're good. But how do you know? You don't know if you don't test. You can't guess. You have to do, we do as a saliva test. You test several times during the day. And then you get, what really is that? And why does someone poop out mid-afternoon? Well, their cortisol levels have dropped down to 0 and they're ready to go to bed. and that's, the hormones control all of this stuff. That's what we do. So, looking back at that health scale, the doctor's goal, what we were taught in medical school, is no symptoms. Keep everybody in that box. Why? It's a good business model, right? You keep people coming back. That's what it is. Do you know where that came from? It came from the 19th century when the Carnegie Foundation paid for a report called the Kinsey Report, and they decided that the Johns Hopkins model was the best business model for managing healthcare. And that's how we got our current healthcare system. They kicked out everybody else. They actually kicked out everybody else to license the MD physician from the Johns Hopkins model. So if you owned a medical school in those days, which there were tons of different kinds of medical schools. There was the Hahnemann Medical School, there were the chiropractors and the osteopaths and the naturopaths and the herbalists, and there were all kinds of things. And if you didn't convert to the Johns Hopkins model, then they put you out of business, pretty much. Except for the chiropractors, they managed to hang out. The osteopaths converted to the Johns Hopkins model. They can prescribe medications and all that too. So if you think about what is in that box, it's a continual illness. You always have high blood pressure. You always have high cholesterol. You always have heart disease. You always have cataracts, and you're not going to get better. You're just going to take the medication to have no symptoms. But what if in the 21st century we can take you out, entirely out of that sick box and get you into a healthier, vigorous health? Why? Because we can test. We know what your hormones are. They couldn't test in the 19th century when they made that model. All they could go by was symptoms. So if you had diabetes, you had diabetes. They couldn't even distinguish between type 2 and type 1. Now we can test. So we know whether you need insulin or not. And the optimal way to do it is to give health to the body. So the way we do that in our office is we use all of the pieces of what health is. So detox, you have to get the toxins out of your body. Now toxins like lead, for example, everybody has lead. It's really how much is going in versus how much is coming out. If you have more coming in than is going out, you're in trouble. But if you have the other way around, you have a little bit coming in and you get it out well, then you're okay, right? And that's true with anything, mercury, organophosphate poisonings, anything, as long as your liver, kidneys, and various ways of excreting the toxins are working, then you're fine. Well, some people look at detox and they say, this is what it's all about. They focus so narrowly on health is all about detox. That's all you ever have to do. And so they do a cleanse, and you're doing colon cleanses, and you're taking detox pills or whatever to try and do that, as if that's what all of health is about, detox. Well, it's important, but it's not everything. Nutrition, same thing. You have people that are so focused on eating the right thing that they don't look at the big picture. But it's really important. Nutrition is really important for health. Fitness is really important for health. You have to be physically fit. And some people are so focused on fitness. I go to a gym. I go to a CrossFit gym. And one of the guys, one of the coaches there is a trainer, and he has big muscles and everything. And I look at his body, and he's got the belly. He's working out. And I say, you're going to get diabetes, because he's drinking those protein powders like crazy, and that's giving him a belly. I go, dude, that's not good for you. And but if all your focus is just the fitness, then you might miss. You can end up with diabetes, even though you're working out. I'm working out, doc. I don't know how I got diabetes. You know, you got to do the whole thing. Let's see. Hormones. We talked a lot about hormones tonight, and now you know why it's really important to know what your hormone levels are. And then the nervous system, how the brain works, and how the nervous system functions is extremely important because that's the most sensitive part of your body to energy production. So people with diabetes get like neuropathy, and people get depression and anxiety just because things don't function right. In fact, it's really interesting. Do you know that the single most common symptom of strokes, of anything that brain dysfunction, multiple sclerosis, strokes, or any neurological dysfunction, the most common symptom is depression. Like everybody who has brain dysfunction gets depressed. And it's important to know why that is. It's partly because of the way the hormones work. And so what we do is we take all of those pieces and we put them together. If we take a whole person and look at each one of the pieces and give them proper nutrition and fitness and hormones, and we repair the nervous system and a detox program, you can put together a program that would actually help somebody get out of that box of illness and into a healthier, vigorous life. And the reason is because that's where you get stress tolerance. Remember, we're talking about stress tonight. Stress tolerance comes from being healthy or vigorous, and that works in any capacity. Think of it in terms of financial. Let's say on the one end of the scale you could be dead broke, right? And then on the other end of the scale you're extremely wealthy. And you follow that scale up, and you get to a point where the doctor wants you to be, and that is, I'm making it. I'm paying my bills every month, but that's it. I have nothing extra. So what happens when something stressful happens, like the car breaks down? You're like, ah, see, now I'm in the sick range. Now I found that finances are sick again. Whereas if you have a really healthy, vigorous financial state, then that your car breaks down, oh, I'll buy a new one, no big deal. Whew, puts me back that much. You can handle the stress. And that's what stress is all about in stress hormones. Stress is normal. It's a normal, natural part of life. We all have stress. Why? Because of change. Do you realize all those things I talked about with stress, that stress the body? It's really change. What the adrenal glands say is stress is change. Did you know that? Did you know that getting married is about as stressful as getting divorced? Roughly equal? There's a Dr. Kabat-Zinn in Massachusetts. He actually draws blood on people and follows them over time. So they're going like this, and boom, their adrenal hormones are up there. He goes, okay, what happened? Oh, I was in a car accident. Oh, that's when my dad died. Okay, so death and birth are about the same level of stress. You win the lottery. You build your dream house on the hill, you move into your dream house. Or you lose your job, the bank forecloses on your house, you have to move into an apartment. Guess what your stress levels are? Roughly equal. Isn't that weird? Because change is really what's stressful. So when you understand that change is stressful and you say, wait a minute, there's no way you can get rid of stress. Why? Because people are going to die. Because jobs are going to change, because companies go out of business, because your car's going to die, because things happen that you don't expect, right? So what you really want is not to relieve stress or remove stress. What you really want is to be able to handle the stress as it comes up. You really want to be wealthy. Like Mahatma Gandhi said, health is the greatest wealth. Because really, if you think about it, if you have $100 million and you're stuck in a nursing home because you can't move, what good is your $100 million to you? Right? Nothing. So really, the wealth that you want is your health. You want that to be the most important part of your life so that you can function, so that you can continue to function throughout your life till the end, whenever that is. I can't tell somebody how long they're going to live, but I can tell them how to be functional till the end. And it's a whole program. If you don't have a whole program, then you fail. And 90% of all failure happens because there's no program that includes all of them. If you take one of them out and you go to the hormone specialist and you go, I need my hormones fixed, and they go, okay, fix your hormones. But you know what? I'm not really well because I still have a fitness problem. I'm not fit, or I'm getting migraine headaches still. So fixing the whole thing and the big picture is really what makes it work. So, can we predict the future? Why? Of course we can. Why? Because we can order the correct tests. We can determine the underlying cause of the illness. We can focus on the cause instead of the symptoms. Correct the dysfunction. Address the body as a whole. And use a systematic approach. And we use something called a mentoring system. And mentoring is like coaching. We don't just say, here, take this pill, and I'll see you next week. We have a system of training. It's just like a coach, mentoring you through each step of the process. Suzanne, that's made your dinner tonight, she's one of our coaches, and she's world class. She's written a book. She has been the personal chef for many famous people. She knows what she's doing, and she knows what she's talking about. She's one of our coaches. We have a naturopathic doctor, we have me, and we have studied for years to understand this stuff, to get outside of the lies, to get outside of all the misinformation, things that you're told. So for example, misinformation that everybody in here has been told. I'm going to tell you one thing. Should you eat 5 small meals a day instead of 3 large meals a day? Just say the same number of calories.
Yes.
Yeah, everybody's been told that. But guess what happens if you do that? You keep your insulin levels up all the time and you get insulin resistant. You need an empty stomach. It's really important to have an empty stomach because that's how the insulin goes down. You have this cycle. And so it turns out cycling is really important for everything. So another thing you've been told is 1-a-day vitamins. Well, that's a marketing thing. It has nothing at all to do with your health. So most of my patients, the people that I help, are on 1-a-week vitamins or twice-a-week vitamins, if they need them at all. And that's the way we do it. Because that is the functional way it happens. If you think about it, think about the eons of existence of all life, and has anything ever been stable like that, where everybody gets their vitamin C every single day? No, never. The apples come ripe on the tree, you get them from August through October, and you get a whole bunch of apples. You get apple pie and apple pastry and apple this and apple that and fresh apples and whatever, and then they're gone for the rest of the year. No more vitamin C. Now what? You get meat because you got to shoot a venison or something. I don't know. But think of the way cycling in nutrition has worked for the centuries or eons of existence. That's really the way our bodies are made. For sugar, it's the same thing. For hormones, it's the same thing. That's the way it needs to happen. So we take people and individuals, we do their tests, we find out who they are, what they need, we outline a program, and then we mentor them through the program, coaching every step of the way, so that by the end of the program, they've reversed all those bad things. We've reversed diabetes, heart disease, cancer. We've reversed Alzheimer's disease. I already told you about one. Alzheimer's, Parkinson's disease, multiple sclerosis. These are illnesses that I was told. I had somebody with psoriasis, and a dermatologist said, oh, that's incurable, there's nothing you can do about it. I go, I can, and she was like, no way, you can't. Oh yeah. Well, turned out the guy was allergic to milk, protein. We took him off all milk proteins, and we had to be really careful because a tiny amount brought his rash back. But completely went away on a 0 milk protein diet. You have to be really careful with milk because they have casein in just about everything. So he could only eat stuff that he got from the farmer's market. You know, that's all you could have. So one time, he's at a party, he's like cured, it's all gone. He was a young guy, he was like 18 years old. It was all gone. So he's at a party, and it was 3 months had gone with no rash at all, and he goes, you know, probably a little bit won't hurt. So he ate some pizza. The next day, his rash came back. The next day. Anyway, just you know, the things that we can reverse are essentially whatever's wrong, because if it happened to you, it can be reversed. It can be improved. Okay, so what you need are 4 things. You need a goal. In order to make improvement, you need a plan. You need a commitment. And you need a sacrifice. That's the way all improvement happens. Anything. You want to learn to play the piano? You have to have a goal. You have to have a plan. But you know what you have to have with the plan? You have to have a true plan. If your plan isn't a true plan, if you say, I want to learn to play the piano, and the way I'm going to do that is by listening to Bach. Is that going to work? No, you're not going to play the piano that way. I've listened to everything in Bach, and I never learned to play the piano. So you have to have a true plan, and that's what we do. And then you make a commitment to that plan, and then the sacrifice is actually following through it and actually doing it. And it really works. Okay, so when you include people in, then they learn and they understand. And that's why we do a specific individual mentoring program. So is it time? Is it time for you to make a change, to actually improve your life, to get well, to get into that vigorous, healthy lifestyle? The longer you wait, the harder it is to reverse a process. So we can take people with early cataracts and actually reverse their cataracts, but if they've progressed to a certain level, they're going to have surgery. We can't do it. Thank you.
Thank you.